What prompted your decision to send the state of New York ventilators?
Well, look, we're all in this together, and it's critically important that we help each other out. Oregon's in a relatively good place right now because I implemented social distancing measures early, and Oregonians have been complying. And so we were in a place where we could provide the much needed number of ventilators to New York, and I'm really pleased that we were able to help out.
And are these 140 ventilators the ones that Oregon got from the federal government earlier this week?
I don't know. They are in our state stockpile. So, but we have the adequate amount of ventilators that we need for the time being. And should we ever need more, I'm hoping other states will help us out.
You did that supply on Monday because you had asked for them earlier. It wasn't like that day you needed them and now something's changed.
Uh, well, what's happened with the social distancing measures, we have been, and Oregonians have done a phenomenal job complying with these social distancing measures. We are reducing transmission and flattening the curve. And so right now we're in good shape. Obviously that can change. And since as Americans, as human beings, we're all in this together, I thought it was really important that take action on behalf of the Oregon spirit of generosity and boldness. And it's truly the Oregon way.
So we had done a story on Thursday talking about the available ICU beds and worst case scenario with the projections coming out of the research in Bellevue about Oregon, how even worst case scenario, we could sustain ICU hospitalizations. Is that still the case?
That is still the case. Again, because Oregonians have done such a terrific job complying with the social distancing measures we put in place. We're in pretty good shape right now in terms of hospital bed capacity. We are still facing other challenges, including access to protective equipment and to testing availability around the state. So it's not like we're out of the woods, but it's critically important that we don't take our foot off the brake right now and continue to adhere to these social distancing measures. That is the only way we have of slowing transmission and flattening the curve.
So I'm sure you're getting this question into your office every single day, but in looking at these new projections that are saying transmission has perhaps slowed by 50 to 70% with your early intervention and all of our social distancing, why can't we open back up businesses, keep school closed, but let people start working again?
That's a really good question. The harsh reality is if we take our feet off the brakes too soon, you're going to see a huge insurgence of cases. And we know this from both modeling that's happening across the country, but also if you look at historically what happened, National Geographic did a great story about the Spanish flu in 1918. And you can look at the cities that that stopped social distancing, and they look like a camel, right? They have a curve and then a lower and then another curve again. And we want to make sure that doesn't happen. And so I'm relying on epidemiologists, physicians, experts, both here in the state and around the country in terms of determining how and when we will take our foot off the brake. But my priority right now is to make sure that we protect Oregonian lives and people's health, and that, you know, we are certainly focused on people's livelihoods as well. But our first priority, our top priority right now is ensuring the health and safety of Oregonians.
So even though our healthcare system, specifically the ICU beds, can handle the influx, we don't want to see the influx.
Correct. And here's the other piece. This is not just about hospital beds. It's about preserving the health and safety of our healthcare workers, of our home care workers, of our public safety officers, our first responders, our firefighters, and our police. It's about making sure that folks in the grocery store who are getting food on the shelves for us, that they all can be safe. So it's about the entire system and making sure we can keep as many people healthy as possible.
Do you have any idea, if not now, when you could lift those restrictions? I guess ease up a little bit, still perhaps keep school out, but open those businesses back up.
So it's gonna, I will just say this, it's gonna happen incrementally, and we are probably a ways away from that happening. Dr. Deborah Birx, one of the advisors in the White House, gave out 3 criteria. One was that we are seeing a reduced need for hospital beds. Number 2, that you haven't seen any deaths in 10 days to 2 weeks. And number 3, that you have testing capacity to continue to test and do surveillance in communities around the state, essentially do contact tracing, determining if there is an outbreak, how it spread, who it spread to, all of those pieces. And you just know from the last piece, the testing capacity, we are several days, probably weeks away from having that ability to do testing surveillance. So we're going to have to look for other measures, and that's one of the things that my team and I are working on.
Got it. So it's not just about, slowing the spread. It's this criteria of 3 different things in order for things to open back up.
Yes. And I think if you were to talk to local epidemiologists, folks like Dr. Dean Seidlinger or Dr. Renee Edwards at Oregon Health Sciences University, they would add in different criteria. So we'll basically put that criteria on the table. We'll wrestle with other data that we're looking at and make a decision. But again, top priority, ensuring the health and safety of Oregonians. Obviously want to preserve lives, and then obviously we'll be focused on preserving people's livelihoods.
And I know you have to get going. Question for you, and I don't know if I don't want to throw you off, but ventilators, the number of ventilators that the state has, do you know that number?
Yes, we sent 140 to New York. We have roughly, with the ventilators in the different hospitals around the state, we have roughly 800 remaining in the state. To make sure I have my math right. And a small portion of those are being used right now.
So we have 800 ventilators currently in the state of Oregon, not including the 140, and only a small portion of those 800 are actually being used.
Yes, that is correct.
Do you know that portion?
It's roughly 40 ventilators being used right now.
In the whole state?
Yes.
Wow.
But those numbers change. So they change, as I've been really clear, change moment by moment, minute by minute, hour by hour.
Okay. Well, I mean, we're not like New York City or New York State
No.
where we're on top of each other either, and social distancing works here.
Yes, yes. So again, I just want to say thank you to Oregonians for their strict adherence to both the spirit and the letter of the social distancing measures I put in place. It's working because Oregonians are being very considerate of their neighbors, their friends, and family members, and I'm incredibly grateful for that.
Okay, Governor, thank you so much.
Thank
Is there
you.
anything else you want to add?
Great to see you. Thank you for your time.